Williams, and a pleasant good afternoon to everyone. Well, the COVID-19 virus, or the new coronavirus, has altered all of our lives. It's August, and most persons in the work setting usually take leave during the summer months. This is August, and travel is now becoming a distant memory. Fitness is becoming a priority during this pandemic. So says The Economist article that I read this morning. And this is important because physical activity helps us to maintain a normal body mass index, or BMI. And that's good because the science is telling us that obesity, persons who are obese, if they were to contract COVID-19, their outcomes are not so good. They are at risk of developing the severe form of COVID-19. And so I implore us to continue exercising. And let me just pause and say that tomorrow, August the 9th, marks the one-year anniversary of the launch of SKN Moves. This initiative was launched last year on the 9th of August, and it promotes physical activity, it promotes healthy eating, and it highlights the importance of individuals ascertaining annual health checks. And so that's SKN Moves. Now, globally, in terms of the COVID-19 to date, there are over 19 million persons confirmed with this disease. In terms of the death toll, it's now over 716,000. In the United States of America alone, there are about 4.9 million confirmed cases and approximately 160,000 deaths. In the Caribbean region, the situation is not so bad. We have about 118,000 confirmed cases, and in terms of recoveries, that's good, almost 58,000. The death toll continues to be low, 1,918. Now, member states, CARICOM member states are reporting an increase in positive cases as a result of the reopening of their borders and the continued repatriation of nationals. In St. Kitts and Nevis, we continue testing suspected cases. To date, about 1,168 persons have been tested. At present, we have 36 persons in quarantine, 1 in isolation. We continue, our nationals continue returning home. At present, we have 37 nationals in government-designated sites, 29 in St. Kitts and 8 in Nevis. Between April the 24th and today, about 160 nationals have returned to the Federation. We have 1 active case of COVID-19. The individual continues to improve, almost recovered. Our last case was announced on July 10th, about 29 days ago. So it's now 29 days since we would have announced our last case. Now, as Superintendent Henry just said, the curfew continues between 2 a.m. to 4:49 a.m. daily. Now, I just wanted to just spend a little time explaining the rationale behind the curfew. Now, there are some non-pharmaceutical measures that we've been employing to help to contain the first wave of infections, and they include wearing of the face mask, hand hygiene, sanitation, physical distancing, whereby you maintain a distance of 3 to 6 feet away from other individuals, and social distancing, whereby you avoid crowds of people and mass gatherings. So now the curfew really means that, during the period of curfew, you head home, you're at home. And just by the mere fact that you're at home, you are just interacting with household members. So you are not on the strip, you're not at a party or a function. And so the curfew enforces physical and social distancing. And so it also reduces the transmission of the virus. So if you're at home, away from crowds, away from other individuals, the risk or the chance of spread or transmission of the virus from an infected individual to a non-infected individual is drastically reduced. And so the rationale behind the curfew is that it enforces physical and social distancing. Superintendent Henry spoke to the wearing of the face mask, but I just wanted to highlight some other points in this regard. And so the regulation says a person shall wear a face mask covering their nose and mouth when in a public place. And so he highlighted these public spaces already. So now what's the rationale behind this regulation? Now, the science, and there are many studies that have shown that the simple wearing of a face mask, again, protects you, the individual, from picking up the virus from an infected individual. And if perchance you do have the virus, it reduces the spread of the virus from an infected individual to a non-infected individual. And so the rationale is that it reduces the spread of the virus. And so this regulation, the aim of this regulation is to help to protect the population, the people of the Federation from the virus. Now, the face mask protects frontline workers. Let me just share. I was exposed to the virus. I had to be tested. And so, yes, I was subjected to the nasopharyngeal swab, and luckily, my sample came back as negative. Frontline workers, we are protected by the wearing of the face mask. When I reflect on my exposure, what saved me was the fact that I was wearing a face mask and I maintained over 6 feet between myself and the individual who was infected. And so I'm sharing this to highlight the importance of wearing the face mask. Now, it says in the regulation that children under the age of 3 years old are exempted from wearing the face mask. So, in other words, children 4 years and above, they are expected to wear the face mask. Now, when the scientists, the researchers, they are looking at the 19 million persons who have already been affected by the virus, and they have found that children are impacted by COVID-19. However, guess what? Many of the children, they remain asymptomatic. They do not have any symptoms, or they only experience a mild form of the disease. However, a small proportion of children who contract COVID-19, they are at risk of developing a multi-system inflammatory syndrome. This is a significant condition. It's characterized by a high fever, prolonged fever, nausea, vomiting, diarrhea. The child can develop a skin rash. You can have redness and swelling of the lips and tongue. You can have redness and swelling of the hands and feet. It's a condition whereby the child's immune system is hyperreactive. All right, and so children are at risk of developing COVID-19, and a very small proportion can be in fact impacted by this multi-system inflammatory syndrome. And so the wearing of the face mask is important, even in those children 4 years and above, because it's going to protect them. The science also tells us that children over 10 years have the potential to spread the virus like adults. So children can be super spreaders. And of course, our children, they interact with their grandparents, and their grandparents may have all the chronic medical conditions, etc. And so I'm just sharing these points to highlight the importance of wearing the face mask. The regulation goes on to say that persons shall not be required to wear a face mask if they suffer with a disability, cognitive impairment, dementia, asthma, chronic obstructive lung disease, and other similar health conditions. So, individuals with lung conditions like asthma, if you feel uncomfortable wearing the face mask, you can seek exemption. But I want to add, or I want to highlight a point here. Persons who suffer from asthma, if you do contract COVID-19, you are at risk of developing the severe form of the disease. And so I implore persons with lung disease, if you do seek exemption from wearing the face mask, you still need to do all you can to protect yourself from the virus. Because if you have a chronic lung condition, and if you develop COVID-19, chances are you may go on to develop the severe form of COVID-19. And so if you seek exemption, you may opt to stay at home. You have to do all you can to protect yourself or reduce your risk of exposure to the virus. I know of acquaintances and friends who do have asthma, and they are wearing their face mask because they are aware of their risk of developing the severe form of the disease. And so even though, there's an option where you can seek exemption, I am equipping you, I am providing you the information that if you do have these chronic conditions, and if you pick up COVID-19, you are at risk of developing the severe form of the disease. Okay, so sports. Now, the previous iteration of the emergency powers regulation allowed, participants in the various sporting disciplines to engage in training and practice sessions. Now, this iteration of the emergency powers regulation allows you to participate in inter-team and inter-club practice matches. So yes, practice matches are allowed between teams, between clubs, but without any spectators. And you need to apply, put in an application to be able to host these spectatorless inter-team, inter-club practice matches. I want to add that the COVID-19 task force would have met with the Ministry of Sports and representatives from all the sporting disciplines at the Warner Park. And then coming out of that very important stakeholder meeting, a committee was established. And the committee consisted of representatives from the different sporting disciplines. And that committee, they developed a very comprehensive document to guide the reopening of sports. And that is the document that the COVID-19 task force is using to guide the gradual reopening of sports. Thank you.